Good afternoon, everyone. Today I'm going to perform the NGT tube feeding, or also known as the nasogastric tube feeding. So the very first procedure to do is to check the doctor's order regarding the amount, type, and frequency of the feeding that we're going to give to our patient. So next to that is I'm going to introduce myself and identify the patient. So good afternoon, ma'am. My name is NGT Noblefranca2C. I am from St. Paul University, Dumaguete, and I am your student nurse for today. May I know your name, ma'am? What is your name, ma'am? Okay, thank you, Ma'am Amelda. So next to that is we are going to inform the patient about the procedure, how it is done, and its importance. So, ma'am, the NGT tube feeding is going to be done by, we are going to insert a nasogastric tube from your nose. It goes through your throat and it goes straight directly to your stomach. With this type of feeding, we will be giving you a liquid form or a liquid substance in which it will be much easier for you since it goes directly to your stomach. And this is given to patients who are unable to swallow and chew. So with this type of feeding, you will be able to receive all the nutrients that you're going to need for your body since your body is healing and is going to heal for the optimal level of health. So is that okay with your ma'am? Yes. Okay. So next to that is we are going to gather all the materials that we are going to need. So um, here I have a tray with all the materials that we are going to need for this procedure. Next to that is wash your hands, and as you wash your hands, perform the proper technique so that the patient would be um, prevented from microorganisms that would be uh, transmitted to her. Okay, next to that is we are going to pour the prescribed amount of osteorized feeding in a calibrated glass. Since we don't have that, we are going to use the typical glass that we all have at home. So here, I have here with me the feeding that we're going to give to our patient. So this formula is the Cerelac mixed with water. So next to that is we're going to position the patient in a high or semi-Fowler's position. So here, our patient is already positioned in a semi-Fowler's position. So let us just leave the patient in that position. Okay, so next to that is we are going to put a towel on the patient's chest. Now the next thing to do is to put on our clean gloves. So here it is. Now the next thing to do is we are going to remove the cover of the nasogastric tubing while kinking it. So here is the tip of our nasogastric tubing. We're going to kink it while we're going to remove the cover of the tubing. Next to that is we are going to attach the aseptic syringe on the tip of the nasogastric tubing. So here is our aseptic syringe, and then insert. Okay, so the next thing to do is we're going to check for the placement of the nasogastric tubing in the patient's stomach. So to do that, we have to inject air into the nasogastric tubing. But since we are using here an aseptic syringe, it would be kind of hard because after that we're going to aspirate for gastric content. And since we cannot withdraw some gastric contents using this type of syringe, so instead, I will be using a smaller type of syringe. So here I have a 10 ml or 10 cc of syringe. I'm going to replace this one with that by still kinking the nasogastric tubing. We'll replace that into this smaller type of syringe. And then after that is you're going to get your stethoscope. So here it is. And then after that is before we eject air into the nasogastric tubing, we have to place your stethoscope over the stomach or the left upper quadrant of the patient's stomach so that we can listen for a whooshing sound. So, ma'am, pwede na kayo yung stomach. Okay, next to that is before you inject air, release the nasogastric tubing here. And then withdraw the syringe. After you withdraw, inject air. Okay, so after that, you will be able to hear a whooshing sound, which is an indication that your nasogastric tubing is in place in the patient's stomach. So after doing that, you have to kink the nasogastric tubing right away so that we can prevent the entry of air into the patient's stomach. Okay, so after that, we need to aspirate and observe for the gastric contents from the patient's stomach. So to do that, release again your nasogastric tubing, withdraw the syringe, and with that you will be able to see the gastric contents from the patient's stomach, which is commonly it is in color green, maybe white, off-white, tan, and sometimes yellow. So next, the next thing to do is to assess for the gastric residual volume. So to do that, the gastric contents that you have taken from the patient's stomach, you need to get that one. And once your syringe is already filled with the gastric contents, we have to separate these contents that you have just taken in a separate container. So to do that, we are going to kink again the nasogastric tubing to prevent from the entry of air. You can now detach your small syringe with the gastric contents in it and put in a separate container. Now the next procedure is, since I have used another type of syringe, so as we are kinking the nasogastric tubing, we are going to put back our septo syringe while holding the nasogastric tubing while kinking it, and then we're going to remove our rubber bulb from the septo syringe, and then pour into the septo syringe your liquid feeding. So the feeding would depend on the doctor's order regarding the amount and the type and the frequency of the feeding. So right after that, you're going to release the nasogastric tubing and elevate your septo syringe 12 to 18 inches away from the insertion site, which is the patient's nose. So as you can see, the feeding is slowly going inside to the patient's stomach, from the nose to the stomach. So that's it. You have to patiently wait for it. And then, if you can notice, if there is a small amount left, you kink again the nasogastric tubing and do not let the feeding be finished, all will be finished, because the air would go inside directly into it. So if there is another batch of feeding left, you pour it all and then do the same thing. Elevate the septo syringe at 12 to 18 inches from the insertion site and wait patiently for it to be finished and taken by the patient. Okay, do the same thing. Now we are going to pour already water. So you could go 30 to 60 ml of water. Flush it with water by first still um, kinking the nasogastric tubing before you release it. Now you release it and do the same thing. Elevate it and wait until the water will be all taken in. Okay. So as what we have done earlier, kink the nasogastric tubing directly right after the water has run through it already. And then now, after that, you can now detach your acceptous syringe. And do not forget to cover your nasogastric tubing, the tip, and then you can now leave it there, like that. Next is remove the towel on the patient's chest. So here it is. Put it on a hamper. After that is you need to instruct the patient, ma'am, you have to maintain in an upright position, so in an upright position for about 30 minutes to 1 hour. Next to that is you're going to clean all the materials that you have used and wipe them and dry them off properly. Next to that is you're going to remove your gloves and discard it in a receptacle or your trash bin. And next to that is do not ever forget to wash your hands properly using the proper technique in washing your hands. And last but not the least is to document the amount of feeding, its type and frequency, and also the amount of water that you have given to your patient and the patient's response as well. So as what I have given to the patient earlier, it was 60 ml of feeding. It was twice, so all in all, it was 120 ml of feeding. And then we've given the patient 60 ml of water as well. And the patient, as I have observed, the patient's response to it, to the feeding that we have given to her a while ago, it was okay, since there are no any bad response or any complications at all after the feeding. So that's it. That would be all. Thank you, ma'am, for your time today. And thank you so much. That is all. Thank you so much for watching.